let's talk about how diabetes affects the eye. This is a model of the eyeball here. And you can see on the inside of the eye there's blood vessels running around in there. Okay, it's trying to get me, but there's the eyeball. See on the inside there, those blood vessels? So what diabetes does is, because of the high amount of sugar, it will bond to these blood vessels in here and cause damage to them. It's called non-enzymatic glycation. And so it's basically the sugar is being forced to attach to the blood vessels, and this in turn brings in inflammation, right? And what happens is this can lead to problems with vision, not seeing very well, and sometimes eventually blindness in much advanced, like later cases. And so the inflammation, though, when it comes into these blood vessels here, what happens is it can cause swelling in here, right? Just like if you cut your arm, it will cause swelling and then some leakage of a little bit of fluid sometimes. Same thing happens in the eyeball, but it's so thin in that area that it will cause a lot more damage to everything around it. And it can cause, also there are some lipoprotein deposits, because sometimes in diabetes the triglycerides are really high. But when those blood vessels are damaged, they bring in the inflammation. Then it also says, okay, I want to grow some new blood vessels because I'm trying to repair that area. And then those blood vessels in turn cause damage as well. So they're growing because inflammation is needed to grow things in your body. That inflammation can damage that area. The blood vessels themselves, because they're so thin, if you look at the edge of the eyeball there, you can see that it's very thin around this part. And so because it's very thin, it can push on other layers, causing damage to them as well. And this leads to your problems with the eye. With you seeing, you can't see very well, you lose vision, things like this. So this is why, one, you get treated with medications that treat things like your high sugar levels, so like metformin, right? That's one of them. As well as your Ozempic, that can treat it as well, very well. This is also why you're placed on a blood pressure medication, because you see how tiny this area is? So you're combating three kind of areas there. It's like increased blood pressure, increased cholesterol, and increased sugar all lead to damage in this little area. So you want to get all three of those things all the way down as much as you can. So sometimes I'll put a patient on lisinopril, metformin, and then something to lower the cholesterol, okay? Then in the meantime, we're also working on other things, lifestyle changes, nutrition being one of them, and I'll go over what the little pyramid of importance looks like, and physical activity and nutrition later. But I'm getting their nutrition. I'm sending them to the dietitian to learn about what are the good things to eat, right? Like whole foods. And then also we're working on some type of maybe strength program, because a lot of times these patients who have diabetes have not participated in a strength program. So those are some other factors, and we're working on multiple other lifestyle medicine factors, so that way we can reverse their diabetes and hopefully get them off of their medications. But that, in a small nutshell, is diabetic retinopathy.